I'm going to do cuff management. So the first thing I'm going to do is check the patient's chart, gather any necessary information that I need. I'm going to knock on the patient's room, introduce myself, apply the appropriate PPE, and then I'm going to check the patient's ID band and get their vital signs, and also take note of the size of endotracheal tube, and also take note of where the tube is placed. So when doing a cuff management, you always want to do a cleaning before you do your cuff management technique. So the first thing you're going to do is go ahead and connect your suction canister to your suction meter. So you would have a -100, -120 when you're doing your suctioning. You're going to get your Yanker ready. So you're going to connect it, connect it to this side. And then what you're going to do is suction out any excess stuff before you do the cleaning. So what you do is you remove that protective sheath back and get the side of the mouth, back of the throat, so that way, but be careful when doing that so you don't initiate the gag reflex. Set that into the appropriate safe area, and then you can go ahead and begin with your oral cares. So when you're doing your oral care with a patient, so this one here, we have a suction swab. You're going to take your oral agent, you're going to dip it in your oral agent, and you're going to get it around the gums, on the tongue, anywhere where you can get built up of anything. So when you're done, you can also connect this to your suction handle, and you can suction out any of that excess agent, oral agent that you may have left in there, and dispose of that. Then always after you do any oral cares, you want to make sure you moisturize the gums, the tongue, and the lips. So when you're doing your oral care, if the tube is on one side, see if you can move it to the other side so that way you get both sides of the mouth evenly. And dispose of that. So you want to do oral cares every 2 hours. So the next thing is going to go ahead and be the cuff management. So the first thing I'm going to do is get everything set up. So here we have our syringe. So we have the 3-way stop here. And so we're going to connect your syringe to one side. You're going to have a meter. And then you're going to connect their cuff deal to there, pressure deal there. And what you're going to do is you're going to do a 2-way test. So you're going to do your minimal leak test and your minimal obstructive test. So what you're going to do for your minimal leak is you're going to listen to the side of the patient, so that way you can hear that first initial leak of that gurgling or crackly kind of sound. So when you're ready, you're going to go ahead and take and slowly remove the air until you hear that leaking sound. And you can also take note always of your meter, so that way if there's anything wrong, you can always note there. And after you figure out and chart it down what you heard the thing, what you're going to do is listen, and you're going to slowly put the pressure back into the cuff, and you're going to listen for when that leaking stops, and take note of where it was at when you heard the stop. And so the next thing what you're going to do is take your low pressure cuff, and this one what you're going to do is you're going to apply it to the patient's off here, and you're going to take note, see where it's at. So if it's up too high above your green, what you're going to do is take your red button here, and you're just going to slowly release that pressure like that. And so you want to have it in the green, so that way you know that pressure cuff is not too inflated to where it's going to cause any sores or irritation to the patient, and that way you know it's not too low of a pressure to where they may aspirate anything like that. So when you're all finished, always double check the placing of your endotracheal tube, and also when you're doing your cares of the thing, some of them you may have to remove the straps. If it's one of those straps that you have to replace, always hold the tube in place when you're doing that. But when you're all finished, always check the placing, the lip level of your tube, and get the vital signs after you're done. Make sure everything still sounds okay, and always check the settings on your machine. Remove any PPE, wash your hands, and then go chart on the patient's chart to let the doctor know that you did a pressure cuff care with them.